According to the CDC, it is now the third leading cause of death in the United States. The Georgia Department of Health reporting more than 2,800 new cases in the state today. That number slowly trending downward. However, we still rank among the highest rates of infection per capita in the country. Of course, the number of additional deaths, 94 of our concerning today. We know these figures lag several weeks behind. They aren't reflecting a drop yet. Most of the deaths are among those with pre-existing conditions or in older patients. The most recent White House coronavirus task force report says Georgia must do more to help protect its seniors. 28% of our nursing homes have at least one COVID positive resident. That's more than double the national average of 12%. Reveal investigator Rebecca Lindstrom asked nursing homes what it's going to take to stop the spread.
Several times a week, the Department of Community Health publishes this COVID report, giving us a glimpse into what's happening inside our long-term care facilities. Westbury Medical Care in Butts County leads the state in the number of deaths with 34. Glenwood Health and Rehabilitation in DeKalb has the most reported cases between residents and staff, 185.
While we have centers on lockdowns from visitation, we still have the staff that work there, the deliveries that are made to the centers.
Tony Marshall, president of Georgia Healthcare Association, says these facilities merely mirror the rise and fall of COVID in the community outside their walls. So we plotted them both. The green bars are cases statewide. The orange, cases in long-term care. Because of gaps in reporting, it's hard to compare, but there does appear a correlation.
Best practice recommendations by the CDC and CMS are that we do weekly surveillance testing of all staff.
What percentage of facilities would you say are actually doing that?
I would say virtually none.
Yet testing is exactly what this White House task force says we need. It recommends routine weekly testing of all workers. Marshall says biweekly testing probably makes more sense, but either way, it's not consistently happening. Capacity and cost may be to blame.
We've estimated for a single round of testing for assisted living staff to cost a little over $1.8 million, and for nursing center staff to cost a little over $4.2 million.
So to do it every week until the end of the year would cost nearly $200 million.
And that's nationally.
No, that's just in the state of Georgia.
A spokesperson for Glenwood Health says after its outbreak, the facility traced the virus back to asymptomatic residents and staff. That's why all 13 of the nursing homes represented by Sava Senior Care have decided to buy their own test kits to test staff and residents weekly when there's an outbreak. But they wait in line for those results, just like the rest of us.
We're simply back at a stage we were in April and early May in regards to getting test results, where we might actually be desiring to do another round of testing before we have results back from the last round of testing.
The federal government is sending testing devices to every skilled nursing facility so that they can run faster, cheaper tests on site. According to the governor's office, Georgia is a priority, and we've received 80 of these devices so far, but they will not help assisted living facilities or personal care homes, which are regulated by the state.